All right, and we're live. Good morning, Miss Diana. How are you?
Good morning, Isidro. I'm doing well. Thank you so much for having me.
Of course, everybody on Facebook, thank you for joining us. My name is Isidro. I'm the Director of Outreach and Fundraising for NAMI El Paso. And with me today is Diana Schultz, CEO of Rio Vista Behavioral Health. Miss Diana, how are you holding up in quarantine?
I'm doing well. It's a new normal as we've
How are you
all,
holding up social distancing? How's it going?
yeah, it's good. It's a new normal as we've all talked about. You definitely change your priorities and your activities. The hospital's still open, so I still get to come into work on a daily basis, but I'm making better use of my time on the weekends. How about that?
Amen. I understand that happy belated birthdays are in order. I know it's your
Thank
first.
you.
Um,
Thank you.
had a social distanced work party on Friday. How did that go? What does that involve?
The team spoiled me rotten last week. So we started off Thursday afternoon with a social distanced cake. So there was a few of us that got together in the boardroom with masks on, spread apart. Of course, we only took our mask off to eat the little bit of cake and go on. And then Friday we had a luncheon, and same thing. We used up the cafeteria, spread apart. Music. And so it was good. It was a lot of fun.
Fun, how exciting. Uh, what's the first thing that you're gonna do once you're back to normal, if we come back to normal?
Oh, so yeah, if we come back to normal, I think the first thing I'm going to do is hit up all the beauty services. I need nails, I need hair, I need to feel taken care of. No, that'll be one of the first things. I know my poor son, his hair grows like crazy, and so he can't wait for his barber to open up as well. So that'll be some of the things. I did mention, I've reprioritized, if you will. And I think one of the things that we're all learning from this situation is that we don't always have to be shopping. We don't always have to be buying things, kind of just getting back to basics. One of the things that I've started doing is exercising more, walking in the neighborhood. And so I definitely want that to continue. I want that mindset to continue. And I find myself more productive. So I want that lifestyle to continue.
Right. Yeah, on the last part, I find myself working a little bit more. Just like over there. So I'll like take a moment, watch an episode of Grey's Anatomy and be like, maybe I'm gonna go answer that email. So
Yeah.
I want to separate my work life again, but I do think I want to see more people continue to walk once we return to normal. More
Sure.
people out, because my neighborhood has been filled with people walking their dogs, riding their bike.
Mm-hmm. Right.
I haven't seen in forever. So I think that would be awesome for everybody to continue doing. So we're here. It's Mental Health Awareness Month. We are, continuing to spread awareness and bring awareness to our community about the importance of mental health, importance of understanding mental health conditions, eliminating and destigmatizing. There's a lot of stereotypes.
Sure.
This year, NAMI's theme is "You Are Not Alone," and it's an important message as people have been social distancing. It's important people don't isolate themselves. But it's easier said than done to say you are not alone when you already have a support system. So Diana, what's your message to those who are missing a support system in their life? How can they reach out to resources in our community to make sure and understand that they are not alone? How do we bring that message to people who just really, really feel alone?
I think those are great points that you're making, because you're right. When we are surrounded by people, family, the family you're born with and the family that you choose, friendships. I mean, I've had lifelong friendships. I've been blessed in that respect. And there's folks that, for whatever reason, maybe they truly don't have anybody, or they're in a situation right now where, that they don't feel they have someone they can turn to. And that creates that sense of loneliness. And so for us as an organization, we want to be as welcoming as possible. So, call us. We'll put you in touch with resources. Calling us doesn't necessarily mean that we're going to admit you, right? But we can put you in touch with resources such as yourself, your organization. There's people that are, loved ones, family members of someone going through a situation, a mental health situation. This is the first time. They have no idea what resources are out there. They have no idea how to react to these types of situations. And so that's where we come in as far as providing information, providing referrals, names of individuals and phone numbers, not just, oh, we'll call NAMI. No, actually saying, we know Isidro, here's the direct phone number that you can call. And so it's that warm handoff, for individuals. And then additionally, on the flip side, those of us that do have a support system, a network system, if you see somebody in trouble, if you see someone needing help, reach out. It costs you nothing to extend a helping hand, a welcome gesture. There's a message, I think, and it's on Facebook, I believe, that goes around periodically. And it says, you never know what someone's going through. So just smile. A smile can turn somebody's world upside down. It can completely change their day. Someone's struggling to get their groceries into their trunk, help them out, and people really do recognize those types of things. It doesn't take a huge gesture, just a small something to make it easier during their day.
Yeah, definitely. Yeah, there's definitely been times where I'm out and about and, it's been a rough day. I'm trying to get my minds off things. People look up, give a smile, and it's like, oh, that's better. That's a turn.
Yes.
A better day. And I think you brought up something very important, that a lot of people don't understand. The psychiatric hospital system and what a psychiatric hospital does. You mentioned, just because they're going to call you doesn't mean that you're going to admit them. And I think a lot of it stems from, a lot of the stereotypes that we see on TV,
Yes.
of what a psychiatric hospital is, of what the crazy houses. It's not like those stigmatizing terms. Can you talk a little bit about what a psychiatric hospital actually is and how you're here to help people in the community?
Absolutely. And I'm so glad you mentioned the word TV, because that is exactly what people have as their barometer, right? So you go to, One Flew Over the Cuckoo's Nest, right? Or you go to Dr. Drew and his private location for the celebrities. And so, those are the two spectrums that people have to gauge that. And because of that, we've put a virtual tour up on our website. So what we do is basically we do crisis stabilization for mental health. When someone is in crisis, and whether this is their first episode or their 51st episode, there are triggers, right? And each one of us handles stress, handles these triggers differently. We each have a different threshold in how we handle situations. And so if someone is already on medication, but for whatever reason they have gone off medication, they are now in a state of crisis, they would come in and their depression may be increased, their anxiety may be increased. Some people are living with bipolar disorder, schizophrenia. And when they're on their medications, they're highly functional. They're working jobs, they're living normal lives, they have families, but for whatever reason they went off, then that's the type of individual that would come in patient for our services. We actually serve 10 years old to older adult. We also provide detox services from, controlled substances, alcohol, that type of thing. We see many, many different diagnoses. And so, on average, we have folks that stay a little over a week. Sometimes they need a little bit more help. We provide group therapy. We provide recreational therapy because that's very important to get exercise, to have creative outlets. We have exercise inside, outside, yoga, things like that. And then we also have a whole series of outpatient services. So when someone completes their time inpatient, they can actually transition to our partial hospitalization program where they program all day, but they are actually still living at home. Or we actually have an intensive outpatient program where they come 3 days a week. And then, also are living at home. And so, we're able to provide a lot of those types of services. And then again, also provide referrals to community resources if they don't already have an established provider, if they're not an EHN client, making sure that they get connected with your support groups, things like that. Just making sure that we have wraparound services around that individual so that anything that they may need, it's right at their fingertips.
Right, awesome. Yeah, definitely. And there definitely is that stigma about the psych hospitals and about counseling in general. We have a question here from Alva on Facebook. Continuing on with the conversation is, how should I conceptualize good mental health? What should one actually be aiming for? And I think it's a little different for everybody, right? Our mental health.
Absolutely, yeah.
Sort of standard for their mental health. But what would you say is a good conceptualization of a good mental health?
So I think that, it is a little different for everyone. And it depends on the situation that brought someone into the hospital. Again, if it was a situation where someone went off their medication, they've been off it for a number of months, that is a component that we're going to address, and that's the medication management. We're going to address, what were some of the situations and the triggers that led up to that individual not taking their medication. If it's financial, especially right now and in a situation where people have lost their jobs, and so they're having to make difficult decisions, right? As far as what are they going to pay for? Are they going to pay the rent? Are they going to buy more medication and things like that? Then again, we can try to help with those situations. We can address that in our group therapy sessions. One of the things that we at Rio Vista try to do is, aside from the typical therapy modalities that are used at almost any psychiatric hospital, we like to also incorporate some holistic approaches. And so people, when they discharge from here, we want them to have not only coping tools that they can use in their day-to-day lives, but some other things too that are a little more tangible. So for example, we have what we call pressure point therapy. And so when someone is feeling a little more anxious, when they're starting to feel, and that anxiety then can translate into pain, we teach them separate pressure points in their palms, in their arms, and things that they can use as they're recognizing these triggers, that they themselves can use to calm back down, to relieve some of that anxiety. And it makes them feel more in control of their own care plan. And I think maybe that would be an individual's barometer of what is good care is, did I feel I was an active participant in my care plan? And do I feel like I left with some additional tools that help me work on some of my triggers when I'm out in, the community and living at home?
Awesome. And you transitioned, you started off, you're the first CEO of Rio Vista Behavioral Health.
Yes.
From Mesilla Valley and Las Cruces. How is that transition? How is El Paso different from Las Cruces? How is it bringing a new hospital to a city? It's a big feat.
Yeah. So I moved to El Paso 6 years ago. So I've always lived in El Paso, but I live in what's considered the northwest side of town. So my house literally is 5 minutes from the New Mexico border. So taking a position in Las Cruces was like driving from the west side to the east side. It took me just as long to get from my house to Las Cruces. But so Mesilla Valley is just a slightly different in some of the services that they provide, only because they do have residential treatment beds where they have patients a lot longer. But I would say, Las Cruces is a lot smaller. I believe their population is only 100,000 compared to our close to 800,000. So there's definitely that small town feel when you get there to Las Cruces. And I think for mental health, there's a lot more familiarity of the patients, right? And so it was like, oh, here comes Willie again, or, oh, we know Lee from the past visit, or, that kind of thing. And so, which I think can have pros and cons, right? The pros is we know what we've done for that patient previously that worked. But I think the con is also sometimes we become a little maybe desensitized, because maybe this stay is something totally different, and we're not actually listening with that keen ear as to what happened to bring that patient this time to the hospital. Whereas in El Paso, because we are so much bigger, there's definitely more services after someone discharges. And so that's a lot of what we had to do here as a leadership team, is learn all the resources available. Like you said, bringing a hospital to fruition, definitely a big undertaking. When I joined our parent company, Acadia, the hospital was still being built. It didn't even have walls. So to see a strip of land go from, tumbleweeds and all sorts of stuff to this gorgeous building that we have now, it's a great accomplishment, but it also comes with its growing pains. So it was a lot of fun, though. It's been a lot of fun. And my house is only 3 minutes from here. So
a lot shorter drive for you
now. Absolutely, absolutely.
As mental health leaders, and you're the CEO of a psychiatric hospital, I think we see mental health in our everyday lives more, and it really just becomes a habit. So, whereas in leaders or other industries don't put much of a focus on it, they're constantly working, they're burning out, they're just doing it, they think it's normal. We may do it, but we know what's happening, and we know it's not okay. What would be your message to other leaders in other industries about mental health and about taking mental health seriously and putting it as part of as a tool for them as they lead their organizations or whatever industry they're in?
Well, I think, first of all, I think those of us in healthcare, whether it's in psychiatric or medical or surgical, for whatever reason, we think we can take on more than anybody else, right? And so it's like the physician that doesn't take, cold medicine because they can handle it, right? And no, I'm the doctor. And I think we do that too. No, I'm the nurse, or I'm the behavioral tech, or, I'm the CEO, I have to be there, right? And so I think that the first thing is recognition. We have to recognize when we're getting on that slippery slope of burning out. Like I said, walking, taking our walks, taking a day, the hospital will still function without you. We have other nurses, we have other techs, from the administrative standpoint, we can take one day and go, when things were open, you could get a massage, or you could, whatever is good for you. Some folks like very light, they like calm. And then there's some of us that, we want a Zumba class and we want high octane activity, right? And that's okay, whichever is what suits you best. The first thing is recognizing that we're at that point when you can't think clearly enough, when you can't speak a sentence, you keep stumbling on your words and things, you can't find reports that you swear you've already done and printed. Those are little messages, your brain, your body's trying to tell you something. If you've got knots in the back of your neck, your body's telling you that it's reacting to stress, that it's reacting to prolonged stress. And so we need to listen to that, and we need to take care of ourselves, because if we go down for an extended period, then we're not taking care of anybody. And that's not why we got into this field, right? And so we need to find out what it is that heals us, and we need to, partake in those activities. And even if it's daily, a little something every day, whether it's a Bible verse, whether it's meditation. For me, I love smells. And so smell a particular candle, that you really enjoy, or or just something like that, or even, just focus on a particular memory for a couple of seconds. That was just a really great memory. Focus on that, close your door and focus on that for just 2-3 minutes, and your whole outlook will change.
Definitely, I agree 100%. As leaders, we definitely need to take some time to focus on ourselves. Sometimes we associate selflessness as a characteristic of leadership, but really, and we talk about it in our classes, is you can't take care of anybody else if you don't take care of yourself.
Right.
And so I think definitely as leaders in different industries and different organizations, we definitely have to take care of ourselves. And I think that's so hard for so many people who have been selfless for so long, but it's going to catch up, and it'll catch up to us fast. Going back a little bit, as we've transitioned and different organizations have had to basically move their operations online, some of the things that's been happening in mental health is there's a lot more telehealth. We saw telehealth coming up in the past couple of years. We saw telemedicine coming and becoming a thing, especially for rural cities here in Texas. But now that a lot of things have to be online, it happened a lot faster. And Rio Vista was really one of the first here in our community who offered, I believe it was telehealth assessments.
Right.
Talk a little bit about telehealth. Talk about how it differs from in-person, kind of the pros and cons, and now as telehealth becomes more popular, there's going to be a lot more for people to say. But what has been your experience with telehealth and telemedicine?
Well, one of the things, this all came on the heels of the stay-at-home order. And, we have a lot of walk-in traffic to Rio Vista. A lot of people coming in just solely asking questions, or a lot of people coming in that truly knew they needed an assessment, really wanted to become inpatient. And so as we were going through this transition of COVID-19, and we started seeing that walk-in traffic was dropping off. And so, people are scared at that point. We're not quite sure what's going on. Some of the bigger cities were getting hit the worst, like San Antonio and Dallas. These numbers were climbing and climbing. So we looked at what are our capacities as it relates to technology. And, we've worked with Zoom, we've worked with Ring Central meetings, there's many applications. And we settled on Zoom. We figured that we could, work with that. We had an extra laptop. And so we started kind of putting the hardware components together. And then we tested it and saw, would this work for someone who's afraid to come in because maybe they don't know exactly what it is, what type of service they want. And so we started working on that. So folks will call in to get information. We'll offer them the teleassessment at that point. And, we've done quite a few at this point. And basically it's like you or me sitting in the comfort of our home, where we feel very safe. And that's step one for any assessment, whether it's here in person or, via Zoom, is making sure that the patient feels safe. And one of our licensed therapists gets on, we schedule the Zoom appointment with them. They get a link very similar to what you and I did this morning. They click on the link and they're on, the therapist is on, and they run through all the assessment questionnaire, just like they would do if they were here in person. So I would say the pros are, immediate feeling of security, safety by being at home, not potentially being exposed to someone else who might have COVID symptoms, things like that. No obligation, right? They feel like there's no obligation to sign up for any service at that point because they're, again, in their home. I think the only con would be if someone is just not comfortable with technology, whether they're not comfortable because they don't have hardware or they're just not comfortable with this, screen in front of them. This is not an option for people that are truly in crisis. When we market this to individuals, if they are in crisis, we tell them, immediately call 911, go to the nearest ER, come here, that type of thing. But if this is a situation where someone truly understands that they're going to be looked at for either inpatient or outpatient services. This is a great way to go. And then they just schedule their transportation to come in, and we'll put them in the most appropriate level of care.
So yeah, it's definitely, I think it's here to stay. I think it's definitely, a lot of organizations are pushed to telehealth a lot faster than they were anticipating.
Yes.
Definitely a lot of trial and error. I know we've experienced it as we pushed our programming online. So it'll be interesting how telehealth continues to grow
Right.
in the community. Earlier we talked a little bit about coping, a lot about techniques, to a lot of the holistic approach that you all take. What have you been doing personally to do self-care during this COVID pandemic?
So I actually started working out for two reasons. Number one, boredom. There's only so many times you can clean the house, right, on the weekends. Closets you can organize. No, actually, and from a personal journey, I have a couple of medical conditions that I need to get under control. Again, sometimes we're not the best patients when we work in healthcare, right? So I've been walking a lot more, and actually been physically working out after my walks. I'm proud to say I've lost 8 pounds. So, been watching what I eat, been trying to be a lot more healthy in the choices that I make in what I eat. And then my mood changes. Sometimes I like, real upbeat music that makes me happy, makes me, feel a little more productive. And then sometimes I really like just some mellow jazz. That helps my mood, and that seems to make me very introspective and, set goals and things like that. And then I also feed my spiritual side. I make sure I'm on Joel Osteen. I watch his daily podcast. Just a lot of positive messaging that I like to access either through YouTube videos or, things like that. And again, smells, love candles, love scents, and it's difficult, of course, because we're all masking, right? We're all masking up. And so that may not be something that I get to do consistently, but I do, enjoy different things like that. Different folks like different exercises. Again, some like a real kind of a hardcore, kickboxing, Zumba type stuff. And then some folks like yoga. I'm more of the higher octane, I like that. I like to feel like I'm getting these results and get the toxins out. So, leave it all on the floor there. But that's basically what I do is, and then laughter is always the best medicine. So my assistant, unfortunately, has gotten me turned on to TikTok.
Oh,
and, and so I spend way too much time laughing at videos on there, but it really is good medicine for me.
Oh my God, I love TikTok. I've been on TikTok for hours every day. Oh my God, I love that.
Yes.
Is there have you tried any TikTok dances? Anything? Are you ready to?
No. No, I haven't tried the dances. I am still hooked on a lot of the Spanish videos, parents, interacting with their kids and the parents learning about the online schooling and the, just the different videos on that. So and it's improving my Spanish as well.
We talked about, a little earlier before we started the interview, you have your mom, you have your family at home. What are you doing, and what's your advice to parents on bringing mental health into the home and having that conversation, especially now as kids learn how to work a new normal and they're not with their friends as much. Sometimes, I know when I was in high school, I would have rather ranted to my friends than to my mother. As I got older, I've grown to tell everything to my mom, but that wasn't true as a teenager. So what's your advice on how do we bring mental health to the home as parents and as people in the household?
So, you know, I've always been accused of, don't analyze me, you know. Everybody always says that. I have a bachelor's in psychology, and so everybody was always, stop analyzing me, just listen. I do have kids, and they're very spread apart. I have a 29, 21, and 17. And
Okay.
so, yeah, each one requires a very different Diana, right? A very different mom, because they're in so vastly different phases of their lives. But I think the one thing that I've always tried to do is, number one, tell my kids, you can tell me anything. I may not like it. It may be shocking, but I need to be that sounding board. And tell me when you don't want me to do anything. Tell me when you just need me to listen, you know? So that way, because I'm a fixer by nature. So if you truly are just needing to vent and you don't want me to do anything, beautiful, I can do that, you know? But if you want me to kind of help you work through a situation, I can do that as well. And you know, for me, trying to be as inclusive as possible. You know, making sure that my kids always knew that whatever they were going through, it was normal and it was okay. And then trying to also remember what it was like when I was a kid, you know, remember what it was like when I was a teenager, when I was 21. You know, it's funny, we just had a situation 2 weeks ago. My 21-year-old who's off at college calls us, and she's telling us the latest scenario, the latest drama that she's going through, right? And my husband and I are FaceTiming her. We're listening. She's crying and, you know, telling me everything. My husband, my poor husband, he's like, I don't understand this. What is she crying about? This is no big deal. But I said, you know, when you're a 21-year-old girl and you're in college by yourself, your family isn't around you, everything's a big deal. And you have to let people get that out of their system. You have to let individuals really talk, and you have to really listen, and you have to say, it's okay. Now let me help you get through this situation, you know? And I think that's the approach that I've taken. And it, you know, I'm not perfect by any stretch of the imagination. You know, parenting's hard and it doesn't come with a manual, you know? And so you work at it day in and day out. It's a relationship, just like a marriage, just like anything. And so both parties have to work at it. And you're right. I remember plenty of times that I would talk to my friends way more than I would talk to my parents. And so I definitely just want to be, I don't want to be the cool mom. I don't want to be their friend per se, but I want to give them a good forum and a good platform that they, if something really is going on with them, that they can tell me whatever it is that they need to tell me. And explain to them, you know, the different levels of mental crisis, and things that people endure and people survive and people live with on a daily basis. And so that there is no stigma for them, that taking medication is okay. You know, that kind of stuff. And so I think my kids are pretty accepting of all of that. And so, you know, they tell me a lot about some of the situations that their friends go through. And so we talk about that as a learning tool for them as well.
Awesome. Yeah, definitely. You know, we have we have an Ending the Silence program that's geared towards adolescents. And really the hope is that this next generation is going to be the generation that has the least amount of stigma when it comes to mental health. You know, they're always talking, you know, it appears on my side that there's definitely an increase of mental health talk amongst our youth, and people having more conversations, having a trusted adult to talk to, understand
Right.
that help is there.
Right.
And we definitely have to do better to listen to our youth. You know, we hear countless stories in NAMI about how, you know, young ones go talk to even their primary physicians or talk
Mm-hmm.
about what they're feeling, and the doctor, someone says, you know, maybe you're a little too young to feel like that. But the reality is that mental health conditions um, affect our youth um, just as much and even more. You know, 50% of lifetime cases begin by the age of 14 and 75
Right.
by the age of 24. So it's really our youth that really have to become more comfortable to reach out and talk about about mental health.
Yeah, no,
I've
absolutely.
that friend and that friend group where I'm like, what are we doing for self-care? What are we doing about our mental health? You know, they may get a little annoyed with me, but I mean, it's an honest conversation. It's a conversation we should all be having. And you mentioned, you know, you have a bachelor in psychology. You know, they ask you not to analyze them. But you know, you come up, you become CEO of a psychiatric hospital. At what point did you know that mental health was for you and was going and has become your career choice?
Well, so you know, when I graduated with my bachelor's, I worked as the first job I got was a recreational therapist. And it was a psychiatric unit within the county hospital in Corpus Christi, where I'm from originally. And so I worked there for a while. And then we moved to New Mexico. My husband was active duty. And so we lived in New Mexico, and I did various things as it related to mental health, mental awareness, things like that. You know, going into kind of more of my professional career as a CEO, I actually started off, the first 10 years of my career was more in med surge. And I don't think a lot of people understand how married medical and mental or behavioral are. You know, one comes with the other. You know, if you've been diagnosed with something horrific medically, there's going to be anxiety, there's going to be depression, there's going to be, you know, helplessness, there's going to be a loss of functioning, you know, deterioration, a lot of that kind of stuff. And that's normal, you know, that's part of that whole adjustment process. And so, you know, kind of when I was given the opportunity to leave one company and join another for that Las Cruces position, I thought, well, gosh, you know, I've worked in psychiatric for a number of years, lots of personal situations, you know, in my lifetime that I've dealt with. So I felt like that was going to be a good combination for me, was, you know, doing that. And now, you know, working here at Rio Vista as well. So I don't know if I've always known that I would be in mental health, or it was just one of those situations where growing up and experiencing certain life events, it just kind of all culminated and led me here.
Awesome. And you know, it is Mental Health Awareness Month. It is a month where we work to bring awareness to mental health and mental health conditions, but it's definitely an everyday conversation. It's
Right.
definitely something that happens after May and happens, you know, 24/7, 365 days of the year. What do you do personally to make sure that that conversation continues in your life and with the people around you?
You know, everybody's got different pressures, right? There's folks that are parents, there's folks that are newlyweds, there's people changing jobs, losing jobs, gaining jobs. There's somebody that knows somebody that's going through a situation, you know, those types of things. And so I think, you know, just making sure that I have people talking, making sure that people understand that, checking people when they say something that might be a little inappropriate, or educating people when they really don't know what a psychiatric hospital is. And maybe they're pushing people away from seeking help because they're afraid that that's a sign of weakness, or I don't know, you know, just various reasons. And so any opportunity that I get to educate folks, I definitely, you know, want to be available for that, be that ear or that shoulder for people that are going through a situation. You know, I've put people in touch with a lot of different resources throughout my career, you know, whether it's to find a psychiatrist or find a primary care physician, or, you know, if they're already inpatient, they're dealing with case management, and sometimes we're not getting our point across, right? I try to kind of guide them in their discussion on so that they truly get all their questions answered. You know, on a rare occasion, I've actually been asked to accompany somebody in those types of meetings and help them with that discussion. So it's constant communication. That's how I do it 365. It's constant. There's, I think miscommunication is unfortunately at the root of a lot of situations. And so really trying to be that impartial party that just tries to get two individuals to be able to see each other's point of view, not agree, but just see each other's point of view, can curtail some of that before it gets into an escalated situation. So I think communication is the key to it all the time, is talking about it. And again, making sure people know that it's okay,
Right?
that everything you're experiencing, it's okay. Now let's get you to a better level. Let's get you to a more positive level.
Right, definitely. And I think that's one of the underlying messages of You Are Not Alone, is
Right.
You're not the only one who feels these things. You're not the only one who's going through these struggles. There's other people and there's resources to assist you in that.
Right.
We a comment here, a question here. If a person engages in a mental health service and they're likely to receive a diagnosis of a mental disorder or mental health condition and be labeled in a certain way, what are some positive ways to think about that label? Because sometimes when we hear depression, anxiety, bipolar, schizophrenic, those serious diagnoses, that's a lot for someone to take in. It's a new diagnosis. It's something they may have not, so for some it's an aha moment. It's like, oh, finally, I can
Right.
I've been feeling. There's a name for it. I know what it is now. But for some others, it's like, oh no, like nobody can find out about this. This is a secret. I'm keeping this with me. What are some positive ways? How do we take our diagnoses and take it in a positive note and say, you know what, take it with stride and work to be better?
So I think you hit the nail on the head. It's that aha moment. And so, think about it in these terms, right? From a medical standpoint, you go to your primary care physician, you're not feeling well, you've got these particular symptoms, they just throw some pills at you, they don't work. You're not going to, when it comes to medical, you will not stop until you get that figured out, right? And when you get finally that diagnosis and that right medication, and you actually start feeling better, you love it. That's an aha moment. And whether that's because you are now a diabetic patient or you're a cardiac patient, you're fine with that because you're feeling better. So it really shouldn't be any different when it comes to psychiatric care. It really should be okay to say, I'm just an anxious person and I'm on this medication because of it. I, live with bipolar disorder, but, and I have this medication, but I'm a functioning individual. I hold down a job, I have a family. It's okay. All of it is part of who we are. I just recently found out that I have quite a bit of anxiety. And so I am on Cymbalta. And I'm okay with saying that. We function on so many different levels. I have hypotension, so I have medication for that as well. It's okay to say all of that. Now, we don't have to go into a job interview and lay all that out, at the very beginning of the interview. You meet someone new in a coffee shop or whatever, you're not just going to throw that out there, right? So it's not necessarily that you're keeping things a secret, but by the same token, that's for you to know, that's for you to live with. You're functioning, you're feeling great. It's okay that your body needs a little extra help. That's fine with that. And so if you come in here, we do our best to keep the HIPAA compliance, to have privacy laws. For example, we don't have a visitation hour where families go on the units and they get to see, like you would see at a med-surg hospital. That doesn't happen in a psychiatric hospital. It's all very structured, very contained for that reason, to keep the privacy of our patients. And so we don't talk about, patients to anybody other than the people that they have designated is okay to have that information. So it's okay to keep things to yourself, but you shouldn't be ashamed of it and you shouldn't be embarrassed by having a diagnosis. If you get the right diagnosis, you get the right medication, you start feeling better, who is to stand in your way to say there's something wrong with that? No one, you know? And so, yeah, there is still stigma, but organizations like yourself, you know, organizations like ours, the whole behavioral health industry is fighting to end that stigma and those negative connotations around those words.
Yeah, and you know, it's again, like we talked about earlier, it's a continuing conversation, um, continuing communication to end that stigma, those words
Right.
that really affect people. And counseling is just another doctor's appointment. It's another thing. It doesn't have to be.
Absolutely.
Doesn't have to be a big deal. I think
Right.
there's a lot of discussion about physical health and mental health. You know, they are one thing.
Right.
And it's your body, it's you, it's the holistic approach. And you mentioned a little bit earlier, but I know Rio Vista does a lot of focus on that holistic approach and a lot of that physical health. Can you talk a little bit more about that and what you're doing and what you're seeing works for individuals out there?
So our building starts off with just, you know, we try to use very soothing colors in the aesthetics on the walls and things like that. We have a lot of very soothing pictures. Our units, each one is equipped with what we call a comfort room. There's actually, it's got dim lighting. There's a rocking chair in there. So when our patients start feeling like maybe there's too much noise, or maybe there's too many people, or they're just getting triggered somehow, they can actually go into the comfort room and just take a little time out. You know, again, 5 minutes, 10 minutes, just sit there and rock quietly. You know, with our recreational therapy, when we do our art therapy, we infuse certain aromas into the room. So we're combining that. We do plant therapy. So we have plants in the room as well. We have physical exercise. We have a huge gymnasium. And so we have physical exercise there. One of the things that we want to start is, you know, before bedtime, yoga under the stars. We have, each one of our units has access to 2 private courtyards. So how great would that be, right? To be able to get out there, get some fresh air, do some stretches right before bed. Hopefully, you know, that could create very sound sleep. And so, you know, just different things that we try to incorporate. We are looking at a company who will pipe in very light music in some of the common areas. So we've been told that when people walk into our front lobby, that it feels like they're walking more into a hotel or a spa. And we really enjoy that feedback, you know, because when you do walk into those things, you feel very, you know, secure. You feel like, oh, okay, this is where I need to be. And that's what we want to carry across from the front door to the end of someone's stay.
Awesome. Sandy left a message. She said hello, giving us a
Hello.
From Peak. Is there, you know, is there a mess? What do we need to do as a community? What do we need to continue to improve on? What's your message, you know, this mental health month to our community, to everyday, you know, to those who aren't in our field, to those who are? Do you have a message?
Yeah, so I think, you know, and I think we're starting. I think we need to do a lot more things that are more concerted efforts, you know. So for example, like your walk, right? The NAMI walk, we get together. And I know that, you know, we're going through a transition with COVID right now, but things that bring all of the mental health community together. And yes, there's some of us that, you know, we're competitors of sorts and things like that. But the more I think that we speak as an industry, the more that we show action as an industry, number one, we could potentially get more funding from our legislators, right? Because we all know that we need more funding as it relates to mental health, whether that be for programming, whether that be for support groups, whatever, you know, we need to advocate for our industry together. Then it would also be, if we got together more and we provided that concerted effort, more education, again, ending that stigma. The more that we're together and the more that, you know, individuals who, as you were saying before, think they're alone and they see us come out in this really strong force, they're not going to feel alone. They feel like, wow, maybe I could join that group. Maybe I could go for the walk and learn something. Maybe I could, get some phone numbers, reach out to people, start my own support group, or, whatever. I think that that's what we need to do more, and I'm so glad that Sandy chimed in, because just because she's in New Mexico doesn't mean anything. Physically, geographically, she's 10 minutes away from me, and so it's like, we're all in this together. Even Mesilla Valley, we're all in this together. So as an industry getting together, but again, partnering with the Hospitals of Providence, partnering with Las Palmas del Sol, UMC, Children's Hospital, all of healthcare, partnering together to say the medical goes along with the psychiatric. We're one and the same. You can't have one without the other. And I think that starts breaking down stereotypes. That starts breaking down isolation. So again, I think we're starting, but I would love to see us partner even more.
Awesome. Yeah, definitely. We're definitely starting. It's been a work in progress. I'm glad to bring up the walk. The walk is, still happening. We've had to cancel events these past couple of months, but we're still scheduled for September 19th at Ascarate Park. All the information is at namiwalks.org/El Paso if anybody on Facebook is interested. And if for whatever reason, if COVID comes back in the fall, NAMI is prepared to go virtual. And so we'll continue that message. And, we thank Rio Vista for being a great community partner
Thank you.
in NAMI Walks. And hopefully we can be out there. Hopefully this year brings better weather than last year. No, what'll happen? Is there anything you'd like to mention, Ms. Diana, about Rio Vista? What is Rio Vista doing? What can we expect from Rio Vista in the future?
So one of the things that I definitely wanted to highlight in tandem with the teleassessments, because we started seeing success with that, for our outpatient services, we also started virtual therapy. And so for those people, again, that felt more comfortable staying inside their home, we still wanted to reach out to them and provide services. And so they are able to join in through Zoom. And it's kind of cool, because we actually have some patients that are on Zoom on our monitors or television screens that are in the same group with people that are physically showing up to therapy. And so our therapists are providing group therapy to both audience members. And so we've been doing that for a couple of months now, and it's going well. And so we hope to continue to grow that. And the nice thing is our payers are supportive of that.
Awesome. That's fantastic. I'm trying to see if there's any final questions or comments here on the Facebook. If you have any questions, please leave them. But thank you, Ms. Diana, for joining us today. Thank you for being a community partner.
Absolutely.
We're continuing these coffee talks with leaders in our community, mental health leaders throughout the month of May, every Monday and Friday at 10:30. NAMI is continuing virtual programming. This Wednesday, we will have a family and friends seminar that you can register for at namiep.org/calendar. But it doesn't look like there's any further questions. Thank you so much, Ms. Diana, for joining me on this Monday morning.
Thank you. It was fun. I enjoyed it. Thank you so much.
And thank you for all you're doing. Thank you, everybody on Facebook. We'll talk